In the last 4 months, 3 of Maine's largest healthcare systems have announced some type of closure or layoff. 10 days ago, Northern Light Health announced it would close Inland Hospital in Waterville. In November, Maine Health announced it will close its birthing unit at Waldo Hospital in Belfast. And those are 2 of the top 5 largest healthcare systems in our state, according to the Maine Hospital Association. Central Maine Healthcare is 3rd, MaineGeneral Health is 4th, and Covenant Health is 5th. Covenant includes St. Mary's in Lewiston and St. Joseph in Bangor. MaineGeneral Health, the 4th largest, just announced it will be laying off approximately 100 full-time employees. It's the latest in a concerning trend about the state of healthcare in Maine. Pearl Small spoke to leaders with the Maine Hospital Association to get the bigger picture.
It's a grim outlook for hospitals across the state, according to Jeffrey Austin, one of the vice presidents of the Maine Hospital Association.
So MaineGeneral and others in the hospital system are out of couch cushions to look under to keep operations going, and are having to make a number of really difficult decisions.
MaineGeneral is the most recent to run out of options, announcing 100 workers will be laid off because of financial problems. President and CEO Nathan Howell explained one of the main problems is a lack of MaineCare reimbursements. The same issue was cited by Northern Light Health when it announced the closure of its Inland Hospital in Waterville earlier this month.
Maine is both rural and relatively poor, and when you have those things combined, it becomes difficult because you're more dependent on government payers like Medicare and Medicaid.
The recent gap in MaineCare funding was a hard hit. MaineGeneral says since state lawmakers couldn't pass emergency legislation to cover the shortfalls, the hospital has been losing $600,000 a week. Even though a 2-year budget plan was passed late last week, the money won't start helping hospitals until the fiscal year starts in July. And even with that, Austin says there are other struggles on the horizon, like state spending plans that might increase taxes on hospitals and about $75 million worth of funding changes that could lead to cuts in hospital-employed physicians. And in Washington, D.C., there's uncertainty around Medicaid funding and proposals to eliminate federal tax exemptions for nonprofit hospitals.
The future is very dark for us unless some changes are made, so I can't make any predictions of just quick recovery.
Austin says the association will continue their fight to protect Maine hospitals at both the state and federal level.
We're not asking for big bailouts. We're asking really just to be left alone. Please just don't cut.
In Augusta, Pearl Small, News Center, Maine.